Hello, my name is Catherine Sawyer, and I am a clinical assistant professor at the University of Illinois Chicago Retzke College of Pharmacy. And this video is to go over a unique thing that you can do with ChatGPT. Now, this is an intermediate level short presentation, so just so that you are aware, you will need ChatGPT Pro in order to do what I am going to demonstrate. So if you do not have ChatGPT Pro, then I recommend either signing up for it or take a look at some of the other videos that we are posting to go over some things that you can do with ChatGPT, just the regular free version. So today I'm going to demonstrate how you can utilize ChatGPT to actually make a standardized patient. So maybe you are aware, maybe you've experienced this, where you utilize standardized patients, maybe fourth years, maybe fellow faculty, or some of your residents. And while some individuals are really great at being standardized patients and provide the exact same information to every single student, sometimes there can be differences amongst standardized patients when you are talking about someone playing a patient. And I have found in my experience that sometimes when your standardized patients provide incorrect information or differing information from some of the other standardized patients of the day, that it can cause a lot of frustration with the students who are trying to complete the different activities. So to help overcome that problem, I tried out ChatGPT Pro, making unique GPTs that can actually play standardized patients and play the exact same patient every single time and provide some feedback to the student who would be interacting with them utilizing a rubric. So first, in order to actually make your standardized patient, you will need to create some documents or knowledge documents for the patient or your ChatGPT to use. So in this case, I have my standardized patient script. This is something I have used in the past that I actually just provided to, a human standardized patient. And this is what they utilize to help answer different questions that the fourth years might, that my different students might be asking. So you probably have documents that are similar, so you'll need that. You'll also need to have maybe any additional documents that were given to the patients, or not the patients, but the students for the recitation, the simulation, whatever it might be. So in this case, this standardized patient, Mrs. Perez, has diabetes and brings in this blood glucose diary for the students. So when the students ask my standardized patient, do you check your blood glucose at home? Then the GPT is able to provide the students this information, very similar to what it would be like if they were actually interacting with a standardized patient in a room in real life. And then next, you will need your rubric, or however you grade your students in a normal setting. So here is the rubric that we utilize that I've uploaded to the GPT. So once you have your different documents that you would like to utilize to train this GPT, then you'll need to actually create it. So what you do to actually create a standardized and a specialized GPT to serve as a standardized patient, you will come over into the right-hand corner and click on your initials over here. You will then need to click on My GPTs. And as a reminder, this is only a function if you pay for the pro version of GPT. This is not something that you'll be able to utilize if you are on the free version. So once you have your GPT and you come over here, you will click on the Create a GPT. Now, I have been working on one, so I'm not going to click on this, but I will walk you through how to actually build it. So you'll click on the Create a GPT. Once you click on it, it will come and it will default to this create section. You definitely can make it in here, but I have found that actually going to the configure section seems to lead to the very best outcomes for myself. So when you open this up, this will be completely blank. There will be absolutely no information in here, including there won't be this picture. I had you use Dolly to make this picture after I actually uploaded all of this info. And as you can see, it made a great 50-year-old Hispanic female, and I could remake it, but that's where this photo came from. Otherwise, you can upload your own photo if you have one for your patient. I named my GPT just the name of my standardized patient. And then this description tells you what this GPT does. So you are aware this is information that your students would actually be able to see. So when they open up this GPT, they will see this exact thing that is over on the right. So you would only want to provide information in here that you would want your students to have when interacting with the standardized patient. Now, the information in this instruction section, conversation starter, knowledge, and everything below here, this the students will not have access to when interacting with the standardized patient. They will only have this screen like this. Okay, so first, what I recommend doing is first upload all of the files that you would like the GPT to utilize in order to actually interact with the students. So I have my patient script is right here. I have my rubric, which is right here. And then I have those blood glucose logs that we took a look at, and that's right here. The web search, the Canvas, and the Dolly are automatically checked when you make a new GPT. I uncheck all of those because I do not want the GPT to be searching the web. I don't want it to open up a Canvas, and I don't actually want it to generate images on the student end. So I remove all of this. I only want it to work with the knowledge I am providing and the instructions I am providing. Additionally, I come in here and I actually will uncheck this use conversation data in your GPT to improve our models so that the information that the students are asking questions and interacting with your standardized patients aren't being utilized by OpenAI to train models. So I'll unclick that. Next, after I've uploaded my documents, I've unchecked these and I've unchecked the additional setting, I'll come into here and add my instructions. One tip is I recommend opening this up so that you can see it in the large format. It's easier to use, but you will want to start by giving some context to the case. So as you can see here, I'm telling the GPT that you are Mrs. Perez, who is a 50-year-old Hispanic female with a past medical history significant for type 2 diabetes, hypertension, and hypothyroidism. You can see that you are telling the GPT that you are referred to the pharmacist for diabetes education and medication management. So I recommend that in everything you're doing, you are telling it that you are, you should, you do. I find that that is the most effective way to get it to actually interact and pretend to be a patient using this very like you are type of language. I then tell it that its second year pharmacy students are going to ask questions one by one. This is an important thing to do so that it actually is going to answer questions one by one and know that questions are going to come in one by one to gather subjective information for assessment and plans. Additionally, one thing that I have found helps make your GPT actually interact like a person, and a person that is very specific, like a certain personality type, is by providing the MBTI personality types, as you can see here. Or you can just say you are a disgruntled individual. You are whatever it might be that you want this simulated patient to be like, so that when the students are interacting with them, they can experience and try out interacting with many different individuals and work on developing the skills to interact with very different types of people across like the spectrum of different personality types. And then I also say each response should be constructed to match his personality type. So one important thing to know when you're training in GPT is that you are as specific as possible so that it actually interacts every single time, regardless of if it's tomorrow they interact with someone or, a year from now, that they're always interacting with anybody that would be working on this GPT in the same way. And then I organize other information using tasks and I number them. I also find that this is helpful to actually get it organized and to have it interact in the same way with every single student, regardless of who the student is. So as you can see, I let it know that the conversation is going to start. I don't give a specific, like the conversation will always start a certain way. If you noticed underneath the instruction is conversation starters, you definitely could put a conversation starter in there, but then your students would need to know to use that exact conversation starter each time that they're working with this case. So I don't do that. I just say like the students should be asking name and date of birth. And if they don't, that you need to prompt them to ask, and that you shouldn't answer any questions until they confirm your name and date of birth. Next, I ensure that you only answer the questions and nothing more. This is really important. Otherwise, I have found in the past when training that the GPT is very, very kind and will provide a ton of information to the students. Even if all they ask is what medications do you take, then it will provide like 8 medications, all the perfect instructions, everything that a real patient wouldn't do. So I make sure to be very clear about that. Additionally, I make sure that the information like needed to answer the questions is found in the specific document, and I'll make sure to put the exact name of that document that you had uploaded into the knowledge so it knows exactly where it should be finding the answers to these questions. I also ensure that each time a student interacts that the questions should be like the information should only be found in the script and you should answer only those questions. I think that that is really important. Otherwise you end up in the situations where it might hallucinate or it might make things up. So being very direct that if it's not in there, you should just say, I do not know. I find that by providing it with just a very specific answer to anything it might know, that it will actually do this as opposed to just making information up. As you can see here, I say you should never make up information. It should only be found in here. Additionally, I was finding that, of course, it has a lot of knowledge well beyond what a real patient might have. So to ensure that it does interact more like a patient, I say if questions use language that is an 8th grade level would not understand, then you need to ask what the word means. If the students are able to give you a different terminology, then you would answer the question. And if they aren't, then you would just say, I don't know. So my best example for this is if a student was to say, do you check your blood glucose at home? Because of this language right here, the GPT will then say, what does glucose mean? because of course not all patients would understand that language. So then this gives the students who are interacting with this GPT the opportunity to see when they use language that is not patient friendly, correct that language, and then get a correct answer from the patient. Additionally, because I do have blood sugar logs, I let the GPT know, like if they ask for, blood sugar logs, then you would provide a chart of the information found in the blood glucose logs attached. If you don't say provide them a chart of the information, then it will provide a link, and that link often will not actually work and download. So I ensure that that the GPT knows it needs to be a chart. Otherwise, saying like list the information, put it in a chart, anything so that you end up not with a link to the log attached, because like I said, it doesn't always work. And then the final direction being, once the students thank you for your time, you should then provide feedback on how the interaction went using the rubric or whatever type of feedback mechanism that you use normally, that your GPT will use that exact same type of feedback mechanism. And then also, like if the student does continue to interact with the GPT, like asking clarifying questions, then it should provide additional information. So once you have all of that, then you are actually able to preview or to practice to see if your GPT is interacting in the way that you were hoping. Once you kind of see if it is interacting in the way you're hoping, what I recommend doing before actually providing it to students who are going to utilize it either in a recitation, a simulation, an assessment or something, is that you get maybe fourth years on rotation with you, you get other faculty, or you get individuals who would not actually be utilizing this for their own coursework to practice interacting with this GPT, and then provide feedback to you on where maybe it is going wrong, if there is any cases of it giving information that is not found in the document. So then you can work to kind of pick through, well, why is it maybe giving that wrong information? What I have found is that if using this exact code right here, which will be placed in a comment below with some of these documents, that it generally doesn't actually give wrong information. It might just provide way more information than what the question is asking. So then you would want to come in here and you would want to kind of fine tune and say only answer, what is being asked. And work through that. But I have worked on this a bit, and I'll provide this info to you. And I have found that generally it does a pretty good job at only providing the information that the students are actually asking with these tasks and this context provided. Okay, so to trial it out and see how it's working, you'll want to just interact just like your students who would be interacting with this, how they might interact with it, so that you can kind of see what's happening. So we'll just play through a few questions. I'm not going to actually do it all the way to the end, but you'll kind of get an idea of how this GPT might work. You can see right here, I didn't ask for it, and it did exactly what I was hoping. Okay, this is the correct date of birth. I know that from reviewing my script. So this is actually starting, yeah, the whole exact little paragraph is exactly what you would find in my script word for word, which is perfect because this is what I had asked prior to having a GPT, my standardized patients to actually say verbatim, right? So then the students can copy and paste this as like, this is the chief complaint. So you see, it definitely was thinking, probably trying to figure out if I was asking a question and looking at its info, and perfect. It didn't give extra information because I definitely don't want that, because I actually wasn't asking a question. So So I know again, this is true, so perfect. So perfect. It is additionally only giving me like the names of the medications as opposed to if you don't be really specific about how much information it would have traditionally when I first was trialing it out, say metformin 500 milligrams and tons of info that I didn't actually ask. And then again, it's only answering the question, so perfect. And again, only answering the question I asked, so that's good. Okay, so perfect. It's only again answering the questions. We'll keep going. Of course, this demonstration is not perfect of like how the students might interact, just to do these like double checking. So then here is an example of something that I know. What I do often when I'm doing the preview or challenging it is I ask some questions that I know students are often doing that are not patient friendly to see if it's interacting how I would like. So. And then here you can see it's actually extracting the information from the document that I had uploaded. And this does look correct, but double checking that that works. Okay. And then I've ended it. Of course, I have ended it before I have actually gotten all of the information I would need. So then you can see kind of how I would be graded as a student. Um, then the student would be able to take a look at this and reflect upon this information to help them improve. All right, so once you have done the testing, then you'll actually need to share and distribute this to have others check it. And then, of course, share it so that your students who are actually going to utilize this standardized patient will have access. So the first thing you'll need to do is click on the share feature. Now, it will default to only me. You'll want to say anyone with the link right here. And then you'll save it. We're going to update this. Otherwise, yours will be just like the creation of it altogether. Make sure that the access is what you would like. You can then view your GPT, which will open it so that it looks exactly like it will when the students access it. Otherwise, you can copy the link right here, and then you can provide that in whatever way you would need to so your students can interact. But we'll click on the View GPT. And then you can see here, it's exactly like what it has shown on the right-hand side, the little information about the case, the name of the patient, and then that little image I had. And then this will interact exactly in the same way. Hello, Ms. Perez. My name is Catherine Sawyer. I'm a pharmacist. I'm here to talk to you about your medications and answer any questions that you might have. Before we begin, can I confirm your full name and date of birth?
Yes, my name is Magdelena Perez, and my date of birth is December 12th, 1973.
Great. Thank you so much. What brings you into the clinic today?
Here to talk to you about my medicine. I'm also tired, feeling dizzy, gaining weight, have a puffy face, and have dry skin and hair. I heard about this new medication called Rybelsus. Would that help me lose weight? Could I take that with my thyroid medicine?
Thanks, Mrs. Perez. Those are really great questions. Before I'm able to go through that medication and answer those questions, I'd like to just gather some additional information. Is that okay with you?
Yes, that's okay.
Great. All right, so as you can see, the students can interact in a verbal way as opposed to typing these different questions. It is a little slower than, of course, interacting with a real human being, only because it takes what the students are saying, it has to convert it into text, and then the GPT needs to determine what it wants to say, and then it would convert it into an audio or a verbal format. But it is, of course, a lot more realistic than having the students only typing these interactions. Um, Now, one additional thing to note about utilizing a GPT for standardized patients is that for students who are utilizing a free version of GPT, then it will default to only allow them to have 10 um, interactions back and forth with the GPT before it would say that it has no more tokens or it won't be able to continue to interact. Now, in order to have the students fully utilize it in the exact format that I'm speaking about and that I bet you are hoping to utilize this for, the students will need a pro version, which is just over 20 some dollars a month. I think from my perspective, or at least here at the University of Illinois, Chicago, that students could even utilize the same account and then just kind of share it with each other, or asking them to purchase it for a month or two, similar to maybe other things that the students purchase in order to experience different things in the classroom. If you are an instructor that does not want to do that and instead have the students utilize the standardized patient, but not purchase the pro version of ChatGPT, then I would make sure that the students know when they're interacting with this patient that they'll need to batch their questions when they're asking them. So instead of asking questions one at a time, they'll need to work to determine exactly what questions they'll want to ask and then batch it into no more than 10 interactions. But like I said, I really do recommend that if you're going to utilize this, you would ask the students to pay for the version for a few months, or they could work together, sharing, say, one account and working in groups and stuff to have this interaction with the patient. But overall, it's a really great way to overcome maybe some of the barriers of having humans do standardized patients, like providing wrong information, providing differing information that can cause a lot of anxiety and frustration from students who are interacting with these standardized patients because they hear from one of their classmates that, this information was given, but then they received this information, and a lot of frustration can occur from that. But I have found utilizing these GPTs and having them play the standardized patients that the students get to practice the exact same skills as what they would have done with humans playing standardized patients. The standardized GPT provides always the same exact information and in many ways is willing to actually grade more closely to the skills and the ability of the student versus when I have maybe P4s grading work who are more apt to be a little forgiving, which of course we want our GPT to also be forgiving, but at the same time, getting that really honest feedback can be really helpful to the students as they progress. So I thank you for listening and watching this video. If you have any questions, please put those questions in the comment, or do you have you tried making GPTs plain standardized patients, and have you found interesting ways or ways to better get the GPT to interact like a real patient would versus interacting like often computers will? So yeah, put your comments below.